school-based programs. Here we're going to talk about various attempts to reduce alcohol and drug use through the school. But first, we're actually going to talk about how to evaluate a school-based program because there's really no point in doing an intervention, implementing this policy, implementing a new program, if we don't know whether it works, or at least we don't have a plan to determine whether it works or not. So really, it's quite straightforward. One, we choose our intervention. Then, which is the simple part, since we know what the intervention is, then we choose our outcome. Now, our outcome can be a little bit tricky. Are we looking at any substance use, starting substance use, so initiation of substance use, how often people might be using some substance, or how much someone might be using some substance? So the outcome does have some decision making required. Now, since this is a school-based program, once we've identified what the intervention is, once we identified what our outcome of interest is, we need to find some schools. And we need to make sure those schools have a bunch of classrooms. And these programs are typically delivered in the classroom to all students simultaneously because they're essentially a captive audience. They're there. And because they're there, they're all exposed to the intervention simultaneously. Now, to make this a real evaluation study, we need to select classrooms at random to receive the intervention and then other classrooms to not receive the intervention. So we have an intervention group and a control group, and the control group can be kind of a pure control group where nothing happens to them, or they could be kind of a placebo control group. We give them some other intervention, just not an intervention related to substance use. Now, ideally, the schools where these students are located would be selected at random as well. Now, practically speaking, that doesn't really happen because you have to get agreement from principals and teachers and superintendents and basically all the hierarchy within a school system. But ideally, that should happen. At the very least, the classrooms, the students who are exposed to the intervention should be selected at random. There should be no other way to design your groups. Now, this is the typical way to evaluate a school-based program, and it is very efficient to delivering some intervention to a large number of people. Now, these hypothetical classrooms here in this school on the slide don't necessarily have a lot of students in each one of them, but a typical classroom might have 20, 30, 40 or more students. So that's a large number of people in a relatively short period of time that can be exposed to your program. The problem with this type of methodology is that it actually, even though you might have a large number of people, your unit of analysis is not the student. Your unit of analysis is always what you randomized on. And since you randomized at the classroom level, your unit of analysis is the classroom. So instead of being able to compare 100 students to 100 students, maybe you can only really compare 5 classrooms to 5 classrooms and see if the differences in those students' behavior change. So statistical adjustments are made for the commonality shared between students within the same classroom because they're learning the same material, they share more of the same environment, they're more likely to be similar to each other than students in another classroom. So while you can expose a large number of students to your intervention of choice, it does decrease your ability to detect differences to determine whether your program is actually effective or not. Now that we know how to evaluate these programs, and I'm sure we are all experts by now, let's go to what some of these programs actually look like. Now, they started by focusing on the dangers of substance use. Just like this poster here, I don't know if that would make students want to use drugs more, or use drugs less, but all in all, they didn't really work. More recent efforts have been to provide objective information about a type of substance. So what is cocaine? What is heroin? I remember going through health class where we had to learn and were tested on every different type of classification of the different addictive substances out there, what the outcomes were, what the consequences were, without really having anything other than the facts tied to them. Other programs work on the student level to build their self-esteem, so making people feel better about themselves might indirectly help them decrease their substance use. They don't feel like they have the need to use a substance to feel better. And then other programs like the DARE program were supposed to be resistance training. I learned how to say no to drugs. Like that was one of their catchphrases, right? Say no to drugs. That's what resistance education is all about. And then we have the social norms program. Norms programs attempt to teach people that how much substance use is going on, how much substance use they think is going on among their friends and in their community is probably more than what's actually happening. So you may think a bunch of people are doing drugs in your neighborhood when in actuality nobody is. So by informing them that nobody is using drugs, or a very few number of people are using drugs, the idea is that you understand what the normative behaviors are and you feel more confident not doing drugs, not using a substance, or not using as much of a substance if you choose to do so, because that's not what's typical or expected of you. Now, of all these school-based programs, there are about 4 common themes. One, they are all directed at the individual. Every single one focuses on you as a person rather than you as part of a group or as part of a society as in a larger context. And because they're all directed at the individual, they all focus on individual behavior change. Say no to drugs. Feel better about yourself. Know the ins and outs of every drug that's out there. So when these are tested, there is not a lot of effectiveness to these programs. There are some statistically significant benefits, so there's some differences between groups, but there's really no practical benefit. Essentially, all of these school programs that focus at the individual, no matter what they are, whether it's just education, whether it's resistance training, whether it's self-esteem training, or social norms campaigns, don't really work. They don't actually decrease substance use or the consequences of substance use. The programs that do work focus on the environment that the students are in. So they create an unfavorable environment towards drug use or a favorable environment towards healthy decision making. So they promote healthy actions, they reward positive actions, like the good behavior game. So in the good behavior game, when you do a good behavior, you get a point. And once you accumulate enough points, your team can win. You don't punish people for a negative behavior. You simply reward them for their good behaviors. And that creates the idea inside a student, particularly a very young student, that I won't get anything good if I do bad things, but I will get really good things if I do make healthy choices. And finally, we're going to touch on college programs, because essentially every college freshman has to go through some program, particularly related to alcohol, even before they step foot on campus, even before they roll in a class. These college programs typically take the information route. They typically are social norms campaigns. And I will say a lot of them, such as Alcohol 101 down here on the slide, are actually created by the alcohol industry themselves. They're the ones who have backed the production of these programs. Now, there is no conclusive evidence saying that these programs work when used alone. There is no freshman year social norms campaign when used in isolation, or a freshman year information only program when used in isolation that works. They might work if there is another component attached to it, which is essentially an individual intervention, such as brief interventions and motivational interviewing. So essentially, if you use the program to identify your at-risk individuals, you can use brief interventions or motivational interviewing to decrease their substance use. But even then, these effects may only last a week, a month, a semester. They eventually die out, and they die out rather quickly. So these college programs, despite their being implemented nationwide throughout the United States, they really don't work as currently constructed.